Well, hello, hello, hello. My name is Laura, and welcome to my channel entitled Laura's Lupus. I created this channel for lupus survivors in order to increase awareness, to educate, and to encourage those suffering with the disease known as lupus. So, today we're going to talk about the symptoms of lupus. Maybe you've heard of some of the symptoms. Maybe you're thinking, I may have that. You're wondering what are the symptoms that will help you to get an accurate diagnosis. And so we're going to discuss that today. We're going to be discussing the common symptoms of lupus and the uncommon symptoms of lupus. There are about approximately 11 common symptoms. And in order to receive an accurate diagnosis of lupus, you have to have four of those 11 symptoms. Also, with lupus, it's not something that doctors love to diagnose very quickly. They like to take their time. Number one, because the symptoms of lupus can mimic other diseases. So before they hand out a diagnosis of lupus, they want to make sure to rule out that there is not something else going on within the patient's body. As far as your expectation, as far as getting a lupus diagnosis, depending on your severity, it may take from 1 year to 4 years in order to get an accurate diagnosis of lupus. And so I just wanted to let you know that up front. It's not something that's easily diagnosed. It does take time, and you will go through several tests, several blood tests, in order to accurately diagnose um, the disease of lupus. So let's jump right into what are some of the common signs of lupus. And I'm reading from um, the Lupus Foundation of America. And you can get this information online, or you can write to the Lupus Foundation of America if you have any additional questions or if you want to have additional information for yourself about lupus. So, like I stated before, there are at least 11 common signs. You have to have four out of the 11 in order to receive a diagnosis of lupus. And these symptoms can occur at the time that you're being examined for lupus, or they could have occurred in the past. Sometimes lupus symptoms will appear and then disappear. So, lupus is a very mysterious and tricky disease, and it's very difficult to diagnose. So, let's jump into it. Number one, joint pain and stiffness with or without swelling. As you can see, that can mimic arthritis. Number two, muscle aches and pains. How many diseases have that as a symptom? Okay, so you get my drift, why it's not easy to diagnose. Number three, a fever with no known cause, no bacteria, viruses, or infections present in the body. It's a fever that occurs on and off on a frequent basis, and it has to be 100 degrees Fahrenheit or above. Number four, feeling very tired. We talked about that on my last video, the extreme fatigue that lupus patients experience. Number five, skin rashes. And these skin rashes can occur anywhere on the body, but the most common telltale sign of lupus present in a person's body or active in a patient's body is the butterfly rash or the malar rash that occurs on the cheeks. If you are familiar with the singer Seal, Seal has lupus, and the butterfly rash that's on his cheeks, that's one of the telltale signs of lupus. Number six, anemia, which is a very low red cell blood count. Also, you can have a very low white blood cell count whenever you're dealing with lupus, and you can have both at the same time. As we know, the white blood cells, they fight off viruses, bacteria, infections in the body, and so the white blood cell count can be very low. Number seven, trouble thinking, memory problems, or confusion. They call that the lupus fog. And that happens with lupus patients. They may have problems recalling a word or names, or they may even have a problem remembering what they ate yesterday, or basically, what they did throughout the day. Okay, so that's called the lupus fog, which is trouble thinking, memory problems, and confusion. Number eight is kidney problems with no known cause. Number nine is chest pain when taking a deep breath. This happens because there's fluid that builds up around the lining of the lungs. This is called pleurisy. And so it makes it very difficult for a lupus patient when they try to inhale and take a deep breath. It causes a lot of pain because of that fluid that's surrounding the lungs. Number 10 is sun or light sensitivity. And what happens with that is that the lupus patient, um, they start to feel like when they're out in the sun, like they're being baked by the sun, or it can cause them to start to feel very itchy when out in the sun, which can cause those skin rashes to occur or erupt. Also, it can give the person a feeling of creepy crawlies. Also, another thing is to be careful if you have a diagnosis of lupus, you will get the same signs and symptoms, the sensitivity around fluorescent lights. So if you have fluorescent lights in your workplace, those may need to be removed. If you have fluorescent lights in your home, you may have to remove those because it will give you the same symptoms of sensitivity as the sun. With lupus, you will have to find other ways to get your vitamin D. And number 11, the very last of the common symptoms is hair loss. Regardless of what spectrum you fall in as far as lupus, whether it's from mild to moderate to severe, hair loss is one of the symptoms that you will definitely suffer. It's due to the activity of the disease, and also it's due to the medications that are prescribed for the disease. So let's talk about the less common symptoms. We've discussed the common symptoms. Remember, there are 11. You have to have 4 out of the 11 present in the body or have happened in the past in order to receive an accurate diagnosis of lupus. The uncommon symptoms include blood clots, for no known reason, DVTs, purple or pale fingers or toes, and they turn this color due to exposure to coldness or exposure to stress. And that's called the Raynaud's disease. That occurs a lot in lupus patients. The next one is seizures. That's a very uncommon symptom, but it does happen in lupus patients. Sores in the mouth or nose, normally they're painless, but this is an uncommon symptom. Another one is severe headaches that occur on a frequent basis. Dizzy spells also. Another one is feeling very sad, which is the depression. And this is something that it can come and go, but it starts to worsen as whenever lupus is active in the body, whenever the patient is having a flare up, they will have episodes of depression that are very severe. Okay. And the last but not least of the less common symptoms is having a stroke. And this happens because of the possibility of having a blood clot. What happens is that these blood clots, they break loose and they can travel anywhere in the body, the lungs, the heart, the brain. And sometimes people with active lupus can suffer strokes. Okay. So I wanted to let you know also we're going to talk about 2 of the main blood tests that are used in order to rule out lupus, and that's the ANA, an abnormal or positive ANA test, and an abnormal or positive DNA test. Now, get this with ANA, and what that means is that it's an anti-nuclear antibody test. And that's something that you hear about a lot. Well, I have a positive ANA, so does that mean I have lupus? No, it does not. A positive ANA is not always a symptom or sign that the patient is suffering with lupus. What happens sometimes you can have a positive ANA one week and you can go back and test again, and the ANA can be negative. And so doctors use several blood tests to rule out lupus, but ANA is one of them. But it is not a definitive measure that a person has lupus because it can be positive one week and it can be negative to the next. The DNA test is the anti-double strand um, antibody test. And we'll talk more about that in my next video when we discuss the blood work and the blood test that doctors will order in order to diagnose lupus. Like I stated before, lupus is not something that's easily diagnosed. It's a very mysterious, a very tricky disease. But the 11 out of the 11 common factors or symptoms, you have to have 4 out of the 11. And then also there are the 2 main tests, the ANA and the DNA. And then there are several other tests that the doctors will run in order to give an accurate prognosis and diagnosis of lupus. Okay, so I hope that you found something in this video informative. If you did, please take the time to like, to share, leave a comment. Also, make sure you subscribe, hit the bell in order to get notifications whenever I upload a new video. I try to do that on a weekly basis. If you have any additional questions about symptoms of lupus, please leave those in the comment sections below. And remember, there is life after lupus, so take care, and I'll talk to you soon. Bye for now.